Hi, I'm Dr. Kristen Kirkby Shaw, and this is Sal, and we're going to demonstrate how to do passive range of motion for the back leg. So if your dog just had recent surgery, say a TPLO or an extracapsular suture for their stifle, their knee joint, you're probably going to be recommended to do passive range of motion beginning a few days after surgery. You may have some reluctance about wanting to touch the leg. It will be probably shaved, there might be some mild bruising, there will be an incision. It's okay to touch and just start with gentle kind of petting and massage of the leg, especially the thigh muscles right in the front of the knee here. These tend to get tight, so we can just do some gentle massage to warm up the muscles. And then we're going to have one hand on either side of the knee joint. And so your dog would have had an incision either on the inside or outside of the knee joint here. So one hand on either side of the joint. We're going to flex the knee until we meet resistance and hold for about 5 to 10 seconds. Now an alternative is to have your hand on the bottom of the paw, holding over the tarsal region here, and you can flex and hold it right like this. This may give you more control. So holding it, again, about 10 seconds, and now we're going to work on extension. And here you're going to have one hand supporting the tarsal joint or the hock joint and extending both the hock and the stifle. Again, going till we meet some degree of resistance, holding for 5 or 10 seconds, and then repeating. And you're going to do that, say, 8 to 10 times, 2 or 3 times a day, or as directed by your veterinarian. The other joints not to forget are the toes. If your dog is not sensitive to their toes, you can just wiggle them and put some degree of pressure on them, especially if your dog isn't putting weight down on their leg yet. Just stimulating the bottom of their foot and wiggling their toes will make them feel like they're touching the ground. The other joint to not forget is the hip joint. So if their muscles are getting tight up in here, we can massage. And then as they extend, one trick is you can scratch right in their hip fold here. One hand right in front of the knee and extend backwards. Get a nice hip stretch there. So again, you're always going to want to perform passive range of motion under the direction of your veterinarian or surgeon. And if you have any questions, make sure that you call your veterinarian and surgeon. This is passive range of motion for the back leg after a TPLO or extracapsular surgery.